First, welcome everyone. Thank you for being here. We had another busy week at City Hall. On Tuesday, we approved moving forward with the development of the new sports museum at the Riverfront Stadium. I'm excited to visit the stadium and to see our new ballpark open and ready for Wichitans. Really be for two reasons. One, because we've invested a lot into it and want to put it to good use, but two, it will likely be a signal that we are towards the end of the coronavirus. Once it's safe to do so, we hope to open up our stadium and other festivities around the city, and I think we all can use some community and some events that bring us all together after the year that we've had. Also, I am excited that we have almost fully approved the 2021 state legislative agenda. We spoke about this a little bit last week during the press conference, and some of you might have followed our online, there was a presentation online with not just us, but with other stakeholders in the city about our legislative agenda and others who had legislative agendas. And during the council, we normally vote to approve that agenda, and there was a request to hold off a week so we can get more feedback from the community, particularly through our social media outlets. I believe our Facebook page has actually has a post up with a discussion with Vice Mayor Johnson and also Councilmember Tuttle going over the legislative agenda. The legislative agenda is actually fairly identical to the one passed last year, with the exception of some language concerning opportunities for federal money that can help with offset the cost of health care, particularly here in Wichita. As we know, lots of folks have been hospitalized for coronavirus and might have some bills. Lots of folks are still recovering. We understand that the coronavirus, there is the long-term recovery aspect of it. So we did add some language about federal, if there was an opportunity for federal money that could help out families who are suffering during the coronavirus or during really any type of medical crisis, that we at Wichita would appreciate that money to be considered to come down to our residents. I think that was the only major difference. But for those who might not have been able to look at our legislative agenda, please go online to our Facebook page and give us feedback. We would love to ensure that we have buy-in from the community, and also if there's anything that we're missing that should be on this agenda, bring it to our attention. I think is what we would want. It is set up a little different. It's formatted a little different than the past agenda, but again, I think most of the items are similar to what the city has had in the past. All right, so one of my favorite parts about being the mayor here is when I get to see on the agenda that we have Sally Stang, our Director of Housing, who is going to speak to us about a program that she is working on. During the coronavirus, which has just taken up so much of my first year as mayor, I met with Director Stang weekly and then every other week about different ways we could help folks who are out of work, who are suffering the economic consequences of this pandemic. We wanted to make sure that not only were we helping or working with folks who were getting resources from the state level, such as trying to navigate the unemployment system, also working with our small business community who was really suffering, but also making sure that Wichita stepped up to the plate and did what we could in order to, at the city level, in order to facilitate services for people who were hit hardest by the pandemic. And I got to tell you, our Director Stang definitely did not disappoint. If you saw my Facebook post, we were able to contribute, I believe it was over $10 million more into our public service funds last year than the year before in 2019. And it's a record, and I'm going to have Director Stang come up and talk about this so she can get more into the details. And it was but it's a record in recent memory of the amount of investment going into our Wichita nonprofit community, the amount of investment going directly to aid and help people who are struggling to put food on the table, people who, for no fault of their own, have less hours that they are working, no fault of their own, might have a spouse or a partner who is out of work and now they're working with one income instead of the dual income, and really having someone such as Director Stang, who is working with the council and working with us to ensure that we can help those Wichitans in their time of need. Now, and I say that we really, first year of mayor, I'm pretty proud that we were able to break records as far as the amount of money being invested, but all that changed on Tuesday. And like I said, I had Director Stang talk about this. We had $12 million, over $12 million go into social services to help folks who are suffering in 2020, absolute record year until the second meeting of 2021 within a single vote, we matched that $12 million. So if we don't take another vote that helps put more services, more federal money into our community to help those in need, if we take no more votes from here on out, we have actually beaten the record that we set last year. And that just shows the forward thinking of our director and really our city council who deserves credit as well. So with that, I want to welcome up our Director of Housing, Sally Stang.
Good morning, everyone. Thank you for having me. We're really excited about the new program. I know we wanted to talk a little bit about the programming from last year, but how do you not start with the new money that's coming in? So as provided in the Consolidated Appropriations of 2021, that we lovingly call the Corona Bus Bill, was $25 billion for emergency rent assistance. This program is administered by the Department of Treasury, so this is new ground for us. Most of our programming in the Housing Department comes from Housing and Urban Development. But with that legislation, each state is receiving a federal allocation of no less than $200 million. That amount is determined by population. Kansas's population, we're getting $200 million allocated to the state. The legislation also provides that 45% of that allocation is available to local governments with 200,000 population or greater. In the state of Kansas, that represents only 3 local governments, Johnson County, Sedgwick County, and the city of Wichita. And so we, in a hurry, I'll be honest with you, so the legislation was passed December 27th. Department of Treasury put the first information up on their website on January 5th about the availability of local governments to apply for this funding with an application date of January 12th. Didn't give us a whole lot of time to act on a new program and a new funding source. So this information is actually changing daily. We were able to get it before the mayor and the council on Tuesday and get the application submitted by noon on Tuesday, which was phenomenally fast for getting things taken care of in just a week. We are still working with our partners at this time to develop the program in its entirety, but this is what I can tell you right now. In order to qualify for funding this allocation of funds, which we expect to be at least $12 million, a family or a household must have a financial impact related to COVID-19. That could be losing a job, fewer hours, less tips, having additional childcare because kids are working or doing school remotely, medical expenses, all of those items can be taken into consideration. They have to have arrears. They have to owe their landlord rent. There's no minimum amount that they have to owe, but they have to be in arrears and have received a late rent notice. Not necessarily an eviction notice, but a demand to pay. And they have to have an income less than 80% of the area median income. With a caveat, though, the Congress decided we needed to and are requiring that we prioritize families or households with income less than 50% of area median income, or households that were employed during 2020 but have been unemployed for the 90 days prior to application. And what makes this program very different than the other programs that we've administered in the past, so we've been running an emergency rent assistance program for several months using community service block grant funds. And we have provided homeless prevention funds through Center of Hope and Salvation Army to try and eliminate evictions. What's different about this funding is that not only does it allow us to pay those arrears, but it also allows us to pay prospective rent and utilities in 3-month increments if a qualifying family, so we're going to help them catch up with the arrears, and then we will make monthly payments for 3 months on the rent. After that time, we'll re-verify if the assistance is still needed, and if so, we could do 3 more months for a total of 12 months of assistance for rent and utilities. This is very different than what was made available in the past and can have substantial impact on households. It's not just that they're catching up for that very minute and then waiting for the first of the month to pass and be in the same situation. We're really looking to collaborate with many of our partners in the community. We've reached out to United Way 211, Workforce Alliance. We're trying to get into the courthouse. We're having conversations with Kansas Legal Services and our neighborhood resource centers so that we can make sure that people who are eligible for this program know about it and assist them to apply. It is absolutely a work in progress. We are scrounging at the moment with our IT department to develop an online application, with our finance department to set up the systems that are necessary to make these payments and to be able to make them quickly. So information changes daily. We get more ideas from more partners and how we can strategize to try and get this money out quickly. One other caveat with this is that local jurisdictions can have their funds recaptured on September 30th if they're not utilizing them, right? And then they're to be redistributed to jurisdictions that are using them. So if we can master this and we can get as much of this resource out in the community, there is absolutely a chance that we could get more to help support our families that are challenged at this time. And it's a financial driver to our economy here in Wichita to bring in at least $12 million in resources. So we're very excited. I'm sorry I don't have all of the answers, that's for sure. It is a project that we are working on every single day, but we can't wait to start helping families get out of this cycle. So that's the new one. And then you wanted me to provide an update or a discussion?
I think I was supposed to
go the other way.
Like this.
There we go.
And this is, and of course, if I had Megan here, then we could put this 1 page, 2 pages on a dual screen. But we do have the details for folks who are interested to know the 2019 versus 2020 allocations and where this is actually where it's coming from our federal, and also it goes down to different areas that we're pulling out federal, but also the contributions for local. And if you are on my Facebook, you would have seen the other documents that are similar that shows what money is going into where.
Yeah. So this is the exact same data that was published on on your Facebook page yesterday. I just restructured it. And what was published yesterday was really about type of service, and we restructured it just to be able to show the funding sources for those services. And that $12 million increase, I have to give kudos to the staff. It has been a whirlwind of receiving additional funding, but getting it programmed and available to people in the community quickly has been very challenging, and they have done a phenomenal job. And it was about really reaching out to the community and to those providers and saying, what is it that's needed? We have these additional funds. How can we program them to have the most impact for families? So if you notice on our list, we did receive an additional $3.6 million in Community Development Block Grant CARES funds that came directly from HUD. So these are different than the general CARES funds that came through the county. They were a direct allocation from HUD, and they could be used for any CDBG eligible activity that also prepared for, prevent, or provided for coronavirus. So we had to meet both tests in applying these funds to programs. Much of what we did was reached out to our existing partners to say, what is it that you need that will help you do your mission because it has been affected by coronavirus? And let us help you fund those activities. But it also gave us that opportunity to fund things we've never been able to fund before. So you'll see we have the Healthy Food Box program, which is providing nutritious food to elderly residents in public housing to try and reduce their exposure. Keep them safe and provide them nourishment. We have the emergency rent assistance program. Obviously, we are running through a CSBG. We are doing the Connect to Compete internet service to low-income families to be able to bridge that digital divide. We're providing homeless case management, landlord initiatives, social worker interns. These are all things we've never had the amount of funding to be able to provide. And it is so important that our partners and these programs really show that when we put money into these resources, that we have positive results from that we make huge, huge changes in the arena of homelessness, because we're providing case management, because we're providing landlord incentives, things that were not there before. And I can't thank the mayor and council enough that they've really supported having creative new programs that aren't just regurgitating what we've always done in different amounts. It's trying to tackle the problem a little bit differently. And I think the 316 hotel acquisition and rehab speaks volumes to that. We stood back and said, here we have additional resources. How can we address coronavirus right now and our needs, but yet still develop a long-term asset for our fight against homelessness? I'm not a proponent generally for building more shelters. It's the most expensive, least effective means to address homelessness. However, we knew with coronavirus, we would need additional shelter space this winter due to social distancing and the space required when keeping people in shelter. By acquiring and partnering with having our partner acquire in Humankind, the 316 Hotel, which opened for shelter on Monday, we're able to provide this winter with COVID-19 spreading so rapidly, additional shelter beds for this winter. And at that same time, while they're providing shelter for people in need, they're doing the rehabilitation to the building to convert those hotel rooms into small studio apartments on the second and third floor. And in 6 months, we hope that all of that rehabilitation will be complete, and we hope that the vaccine will be effective and we won't need the expanded shelter services, and we'll be able to convert all of those units into permanent supportive housing. With additional 54 units of permanent supportive housing for our task of ending homelessness in our community is a huge, huge win. And without the support of the council, this is very different than what we normally do. Without Humankind willing to take a chance in trying something new, we wouldn't have this opportunity. So I stress with our partners, as I do with our staff, we need to make the most of it. We need to show that it works. But you'll see through the list, whether you're looking at it by funding source or by activity, we have covered so many different basic needs for folks in our community, whether that's domestic violence shelter services, food, it's assistance to the youth enrichment programs, helping kids after school. We are providing hotel, motel vouchers for those testing positive that are homeless. We are providing additional resources across the board. So it's been a challenging year. We recognize that this level of funding is not going to continue, so we have to show that it works.
So we got a couple more items, and then we can get to questions about the total.
Yep.
Questions about the total after the next two items we're going to go over. Then we'll have questions about the total presentation. Sorry, I know where people want to jump into questions. There we go. I'm like, I think you got my script, but totally gonna wing it because I normally do that anyways. And so the next thing we're gonna just talk about, we're going to talk about our library, in particular our new library center, and then also get an update on our roads as winter's in full effect. So we'll be quick with these, and then we can get to questions because I know that there are a lot of questions. So as you guys recall, last week we did approve the naming of the new library branch going into District 3. It's the Dr. Ronald W. Walters library branch, and we look forward to the ribbon cutting ceremony and really just making sure that District 3 has access to this new space. And we're going to now have Sean come up from our Wichita Public Libraries and just tell us a little bit about that.
Thank you, Mayor. Yeah, so like you said, last week we were able to get the new name for the new District 3 library. It'll be the Dr. Ronald W. Walters branch, and it'll be located at 4195 East Harry Street soon. In order to open at that location, we first need to close down our Linwood Park branch and relocate it to that new location. So tomorrow, January 15th, will be the last day of operation for the Linwood Park branch library. And over the next couple of weeks, we will begin moving materials and equipment to the new location. As of right now, we are expecting to begin library services at the Walters branch on Monday, February 1st. We will hold an official ribbon cutting ceremony towards the beginning of March to make sure we get all of our signage up and get everything in place at the new facility. Earlier this week, customers with holds ready to pick up at the Linwood Park branch were contacted by library staff asking if they'd like to have their holds picked up by January 15th, transferred to another branch location, or have an extension on their holds to be picked up at the Walters branch beginning February 1st. Staff also reached out to customers whose holds have not come in yet to see if they'd like to change the pickup location or pick up at the Walters branch after February 1st. And if customer holds come in between January 16th and February 1st, they will be held in delivery boxes and will be transferred to the Walters branch to begin picking up on February 1st. Librarians have thought of everything, I promise. The book drop at the Linwood Recreation Center will remain open until January 31st. Staff will monitor the book drop during this time, and beginning February 1st, customers will need to begin returning materials to other library locations or at the Walters branch. Right now, all library locations are offering curbside services, so when the Walters branch does begin service on February 1st, the building will remain closed to the public, and customers can utilize the library's curbside service to retrieve materials and also print, copy, and fax items. We are working on several virtual tours that we'll post on social media for customers to view, and when it is safe to do so, we will welcome customers in to see the new facility. We ask customers to call 261-8500 if they have any questions about the relocation process. And that's all I have.
Thank you, Sean. Oh, I just knocked over one of you guys' mics. I think we're good. My apologies. So the next person we're going to have is Ben Nelson come up. He is going to talk to us about really an update from the Public Works Department as winter is in full swing, and as most everyone knows that, you know, even though yesterday was kind of a good example of Kansas weather, right? Like we've had a lot of snow and ice last few days. Yesterday was really nice. However, our Public Works Department is hard planning, making sure that when we do have bad weather, our roads are ready. So Ben, if you would give us an update.
Absolutely. Thank you, Mr. Mayor. And I join him in looking forward to sunny, warm days in the summer, watching baseball instead of having to worry about snow and ice. But we're obviously in that season. We're probably about halfway through the season now. Like the mayor said, we start preparations for this usually in the spring and summer leading into the fall. Just to give you a little bit of history to date of what we've done since this winter storm season began, we've had a total of six activations so far of our full snow and ice contingent response. That's eaten up about 15,000 labor hours over the course of those six activations. The first one that we had was actually back in late October, which is a little earlier than normal for us. We generally don't get a lot of snow or ice in October, but for the second straight year, this past October, we had measurable snowfall. We've deployed 6,000 tons of our normal salt and sand mixture as part of those deployments, as well as another 43 tons of calcium chloride, which is a special type of salt treatment that melts ice and snow at very low temperatures. The normal sodium chloride that's part of our salt sand mix isn't as effective once it gets down to 10 degrees. So this calcium chloride helps supplement that. I double-checked this before coming in, but we've driven a total of just shy of 88,000 miles during those activations, which would, if you could put a road all the way across. I've done the same thing. I should just not talk with my hands. Sorry about that. Can you still pick me up okay? If you could put a road all the way around the equator, you'd be able to drive around it 3.5 times with the amount of miles that we've traveled during the snow response. And so I say a great deal of thanks to the more than 170 people who were involved in our snow response. Obviously, we're hoping for a very light snow and ice season for the duration through March, but we'll continue to maintain our readiness for snow fighting through making sure we're fully stocked on our materials and our fuel, and make sure our folks are available for whenever nature calls. Thanks.
Excellent. And there's something reassuring when someone else knocks over one of the microphones, makes me think it's not just me. So thank you for the update, Ben, and also for the confidence boost. So with that, we'll open up to questions for anything except for the library, because I think Sean stepped out, but Ben's going to be here, and I think a lot of the questions might be for Director Stang on, the stuff that we are announcing here. So yes, ma'am.
So question on the new funding, do you guys have a name for the program, and when and how can people apply for that program?
Awesome question.
Thank you. Department of Treasury refers it to as the ERAP program, Emergency Rental Assistance Program. So for consistency, we're keeping the same name. We are hoping to have an online application up in place of our Emergency Assistance Program application that was taken down in preparation for this one. But that is dependent on us being able to get the imports into the systems and receive the funding. But we're aiming for the end of the month. And it will be an online application. And we do want to have agencies and people positioned throughout the community to assist people in applying and uploading their documents.
You could throw out a figure of how many people could be helped with this?
That's a really tough question, because there could be a single family that only receives a couple $1,000s in rent assistance or utility assistance, and there could be another one that receives the full 12 months for both rent and utility. So every circumstance is going to be very different. And that is something, again, that differs from the previous program. We had a $1,000 cap. This one does not provide a dollar amount cap, just a time period cap. So 12 months, maybe with an extension to 15 if funding and need is still present.
What's the status on the eviction moratorium right now?
Sure. The Cdc Eviction Moratorium expires on January 31st. And if I was a betting person, I would say they're going to extend it. I cannot guarantee that, but my guess is under the Biden administration, they will extend it. It would be completely challenging for Treasury to provide $25 billion in rent assistance just 5 days before the eviction moratorium expires. So we are hopeful and think they will do the right thing to, at least for a temporary, for a short period of time, so we can get the money out to the community.
You anticipate a backlog once that moratorium, whenever it does expire?
Absolutely, and that's why we want to try and get in front of it. We don't want to wait till landlords are actually going over to the courthouse and filing for an eviction. We want to make sure we'll be doing outreach through the Apartment Association of Greater Wichita. We'll be doing outreach to landlords where familiar with, hopefully through the media too, so that both landlords and tenants are aware that this is a resource. The legislation does allow for the landlord to initiate the process, but they do have to obtain the tenant's signatures and documents to move that process along. So we'll be going both paths.
How much does the city spend itself on enforcement of these eviction notices in a normal year? I know this is a not normal year.
The
but-
city itself does not at all. It's all, all evictions are handled in the county courthouse. So
Even for people that receive public funds?
even for people who receive public, all of those evictions go through the county courthouse. And that's why,
The landlord is responsible for that.
I'm sorry?
So the landlord is responsible for that?
For abiding by the moratorium, absolutely. There is,
For all eviction notices and requests.
correct. Any owner of the property or managing agent for the property who has authority can file an eviction.
So you don't provide any support or enforcement in evictions?
No, we don't. No, we don't.
It's a lot more money just in last year that housing is handling. Have you guys hired any new staff or added additional staff, moved people around to actually handle?
Yeah, we've hired 2 temporary staff members at this point. We do know with the ERAP program, we are going to have to bring on additional temporary staff and then also lean on and fund positions in these other organizations to help make this happen.
And did you say that it was for rent and utilities as well?
It is rent and utilities, which does include water, sewer, trash.
Is that just for the residents or is it any business?
It is just for residents, it is not for businesses. And it is rent only, not mortgage assistance at this point. We do offer mortgage assistance through our emergency assistance program, the one funded through CSBG, and that will likely continue. My conversations with the agencies in our community and our staff is, while we have this treasury assistance, we need to focus our resources or all these cases towards that resource, because other resources such as community service block grant, community development block grant have much more flexible uses. So while we have this targeted resource just for rent and utilities, that's where the focus should be. Again, because if we fully expend the money, there's a chance we could get more. The worst thing to do would be to leave money on the table.
Some questions. Sure. Just what we're looking at here. The last page. The total there, if I'm reading this correctly, it looks like one is how much the city spends and the other is how much of that is federal dollars, but it doesn't add up to 12 million. So I'm trying to figure out exactly what's what.
This is just a continuation from the first page. So this is federal CDBG funds that total these amounts. This is federal ESG funds that total this amount. This is federal Section 8 HCV funds that total this amount. These are local general funds. They total this amount, and all together, all of those resources total that amount.
So it looks like up at the top 316 hotel is in there for $2 million.
Yes.
I don't know if that's at the top.
It's not a duplicate. No, that was a that's a $4 million, little over $4 million project in total. Because I broke it out by funding source. If you notice on the other version, it's in there as one line item, but we took $2 million from CDBG CARES, and then, we took the additional $2 million of local funding.
I had some inquiries on Facebook last night from folks who wanted to see it broken down more from the funding source. So that's why today's looks different than yesterday's, is we want to be able to provide a more full picture.
And I would assume you'll have electronic copies sent to us of this document?
If you would like, we can send you.
That would be great, yeah.
You have to give me a follow on Facebook or you can download it, but yeah.
I would imagine we'll probably find it.
Further questions for Sally?
Thank you.
And one of the real important things, and besides just being excited that we're, I think, able to answer the call when it comes to helping folks in need during what has been just an awful year, one of the also reasons why we are utilizing press conference time for this. We are utilizing our social media outlets to talk about this. Is there are a lot of people who might not realize they qualify for some of this. There are some folks out there who've never once asked for assistance for anything, but find themselves in a economic situation because of the coronavirus, and are struggling and might not know that these programs are there. So we want to make sure we get the word out the best we can. And really, it's we do better here in Wichita when we're looking out for each other, when our neighbors are looking out for our neighbors, and when we know that our neighbors are going to be secure in their housing. So please. Thank you. Well, thank you for helping us get the word out. But please, for those who are watching, if you know someone who is in a position of economic downturn because of the coronavirus and struggling with utilities or with rent or with, I think we're, to be honest, I don't want to get too far ahead, but we're actually looking for programs to help with childcare assistance. We're looking towards, this isn't going to be the last time we talk about this. We're definitely looking, by having our ear to the ground on what people need through this crisis, looking at ways to respond to those needs so we can focus on taking care of Wichitans until we are on the other side of this crisis. So with that, your chance, right? I haven't seen anyone from the Eagle for so long. Sometimes I forget what you all look like.
More question on what is the median income level that you guys are looking at, where you look at 80% or 50%? Sorry to play back up there.
It's a real question. You go, Sally.
So those income levels depend on the household size. And so the 50% of the area median income for a household of one, it's about $25,000. It's about 40 at the 80%. Remember I said we have 80%, but we have to prioritize those at 40. Those numbers are published on our website because we use them for multiple programs, those area median income numbers.
And also, I would just ask personally, as my position, if folks are going through this process, we would love to hear about their experience with it. So reach out, let us know how the experience going through this has been when it comes to accessing these programs and these funds, so that we can work to better access if there's issues that we didn't foresee. I think this is a bit of an unprecedented year, and we're going to learn as the rollout continues. But in the end, we want to better our services and have a focus on customer service. Any other questions? Chance.
I had a question on the legislative agenda.
Yes.
There seems to be some ambiguity there about what the city means by federal funds. Is the city council, the city, in favor, not just you personally, of Medicaid expansion? Is that something you all have talked about?
So, all right. So I am on the record voting for Medicaid expansion, and so does the Wichita Chamber of Commerce, and so does our hospital association here in Wichita. So does our, I think our Sedgwick County Medical Association. I think it's on their agenda as well. So, but I can't speak for the city council. I will say that a lot of the folks who might sit on some of those boards might also be serving city council. I'm not sure. So I really can't speak for everyone. But the language was utilized not just, I guess it can be interpreted as Medicaid expansion, but also because we are in a pandemic, we are in a crisis, we are looking like we might get, hopefully some money that would prevent medical bankruptcies for folks who had to spend 4 to 6 weeks on a ventilator fighting for their lives, or their loved ones did, and the loved ones, lost the battle, and now they have to pay the medical bills. So moving forward, judging from, it seems like the appetite in Congress to help make us as whole as we can be going through this crisis with programs like the ones we just went over, it wouldn't surprise me if there was a vehicle for federal help towards our hospitals, which I think is our number 2 or number 3 largest industry here in Wichita, is our medical industry. Huge economic driver. And so if there was any funds that would help make them whole for, trying to save the lives of people who happen not to have health insurance, if there is any type of federal programs that could assist folks pay off the medical bills, that's more of what we are gearing towards, opposed to just, I think, some of the same old fights that we've seen in the legislature, particularly Medicaid expansion. But the short of it, I don't know if I don't know if the interpretation of that language and the actions of the council members who wanted to slow down the passing of the agenda, if that was done so with concern for Medicaid expansion or not.
So you said it would be fair to interpret that as written right now as it could encompass or include Medicaid expansion.
Oh, yeah. Okay. That's federal money coming in to help folks who can't afford access to health care gain access to health care during the largest pandemic our country has ever seen in the last 100 years. So I think that would count, but yeah.
Kind of change course here. At the beginning, you mentioned baseball. There was a report, I think it was last week or earlier this week, that minor league baseball is delaying their season a little bit. Does the city have any updates to share as far as when the ballpark could prospectively open for either training camp or for other events that are not baseball related? And
That's a good question. Jonas, do we have any? No updates on that. Sorry, I wish I knew more so I can answer that question. Other questions?
so we have vaccine rollouts.
We're so glad you're here, by the way. Yes, more questions from Chance and the Eagle. Yes.
Does the city have any plans to get in on the on vaccines in any way, from marketing, from assistance somewhere? I mean, it's sort of this huge initiative to get everyone vaccinated in a very short amount of time. Does the city play any role in your mind?
The city stands ready and able to assist in any way we possibly can to help ensure that the citizens of Wichita have access to vaccinations when called upon. Right now, the avenues for vaccination has gone through the state level and also the county level. My role as mayor has been, and really the role of the city has been somewhat what it's been throughout this pandemic, with a few exceptions, and that's riding alongside their efforts, getting the information out. I had a call with the VA yesterday to talk about they will start vaccinating folks for phase 2 in the near future, and if you are an eligible veteran, that's probably the quickest and fastest way that you will be able to get access to a vaccine. Also, over at the arena, if you are someone who's not only in a medical field, but even the medical field which might not directly work with coronavirus patients, please call the county health department and make an appointment. I believe that includes mental health. I believe that includes social workers. Right now, that phase 1 of getting folks who really are helping on the front lines, and even helping folks maybe not on the front lines, but also mental health and physical health, getting those folks that first shot is the goal of phase 1. And my understanding, according to a conference call I had last week with the governor, is that we are likely to conclude phase 1 early. I think they were thinking it would go out to the end of June, according to the governor, and everything's up in the air, so I gotta definitely throw that in there. But she believes that we will probably conclude maybe a week early on phase 1, getting to phase 2.
I do have another question. Have you been vaccinated? And if not, when is your turn?
So, to be honest, the mayor is definitely replaceable. I have not been vaccinated, and I would hope, and I am fighting for our security, to get on the list as first responders. That was part of my call with the VA yesterday, along with our chief of firefighters, along with our police officers. We want to make sure that they get vaccinated. We have a lot of folks who work here at City Hall who interact with people all the time, and they didn't slow down during the pandemic. Like, we didn't come to a stop, right? Like, Sally sure didn't slow down, or excuse me, Director Stang. You know, I am in a position of privilege where I can do Zoom meetings and I can come to work and not really, I guess, put myself as much risk as our security personnel, our first responders do. So, no, I have not pushed to get myself vaccinated at this point. But I will say that if I had the opportunity, I would take it because I do believe that the vaccination is safe and effective according to the science, and I've followed the process. And I've also actually thought about doing and looked into possibly a trial. So, you know, try to do my role a little bit where, see if we can we'll be in a much better position in the next couple of months if we can get a couple more vaccines online. And it looks like we're close. Like, it looks, and I'm not a useful doctor by any means, or in medicine, but it looks like we're getting closer towards that third and fourth approval for different technology vaccines coming through, which will be a game changer. My communications person's telling me I'm talking too long, so what else we got? All right, nothing. Excellent. Well, thank you all for being here. Thanks for being here so long. This was a longer than normal press conference, but we have a lot of information we want to get out, and we heard that the Eagle might be here, so we want to make it worth their time. So thank you all.